Hello again. After a long time, I'm recording a new video. Hope you enjoy it and may have some questions. Trying to visit an old topic, asthma. As we have talked in the past, asthma is known for many years, and it certainly affects Asians more in this country than Asians or Indians in India. The reason of this is not very clear. It could be that the immunity that is fighting against the repeated infections or infectious processes in India is not needed here, and subsequently it turns inward and causes the problem with ourselves. Again, this is only a thought process, not certainly which is proved, but there is some incidence, or rather some evidence, that the incidence of asthma is a little bit higher in Indians in US than Indians in India. Again, the asthma is such a condition where being born in New Zealand has a high incidence. So again, we don't know exactly why, but there are newer and newer treatments coming out every day. So I thought of talking about basic treatment and a couple of new treatments that are available. So we all know that asthma is an inflammatory process. It causes inflammation in the bronchial tubes, leading to swelling, leading to irritability, leading to more mucus formation, and that causes bronchoconstriction, and then shortness of breath, wheezing, etc. Basic treatment of this is again steroid or anti-inflammatory, though other medications that break this cascade of the inflammatory reaction or cascade chemicals are also developed. So we had a singular or Montelukast, which is nowadays used less, but was certainly developed for fighting asthma and allergy as a pill. But the steroid inhalers have continued to stay as the mainstay of the treatment. Then came the biologics. As you know, everywhere we are talking about immunotherapy. And I'm sure you've heard about these kind of therapies for rheumatoid arthritis and lupus and eczema. Also, you've heard about it being used in cancer. And basically, it is allowing certain biological interventions. The therapy that we do with asthma has been directed to two main sources. People who have allergic asthma have elevated globulin called IgE, E as an elephant. And they also have an elevated white cells called eosinophils. So the targeted therapy for asthma was either related to anti-IgE, immunoglobulin E, or was targeted to reducing the eosinophils, which are found infiltrating in the bronchial tubes in asthmatics. So this causes inflammation. As mentioned before, inflammation leads to swelling. Swelling leads to irritability. Irritability leads to more mucus, bronchoconstriction, wheezing, shortness of breath, more susceptibility to infection, etc. So we have been talking about using steroids locally in an inhaled form, which is the oldest treatment, and combining it with a bronchodilator, something which opens up the bronchial tubes. This has been a mainstay. The commercial products available were Advair, Symbicort, Dulera, and Brio. And then, of course, we came out with combination of products of additional bronchodilators. So the two other ones that came in the market, though one of them is still not approved for asthma. One is called Trilogy Ellipta, which has 3 drugs, as the name suggests. And it has a steroid as well as 2 other bronchodilators. And the Breztri, BREZTRI, is a product which is only approved for COPD, not approved for asthma, but off-label some people have used it. So essentially we have a combination of steroid and bronchodilators as a mainstay. As far as IgE is concerned, we still have one product called Xolair, and that is used as a shots every 2 weeks, and that seems to control asthma fairly well. Of course, we have to continue to use steroid inhaler and bronchodilators as needed. So it has been proved that use of Xolair reduces the use of rescue or bronchodilators inhalers. And the new one after the Xolair or anti-IgE came was the anti-eosinophil. And those were the two products called Nucala and Fasenra. These are also given as shots. They reduce the eosinophil in the blood, and they also reduce the eosinophil at the site of inflammation in the lungs, leading to relief of asthma. Again, we still continue to use other medications, though amount that is needed is substantially reduced in studies. So the Xolair is anti-IgE, the Nucala and Fasenra are the two ones which are used as anti-eosinophils. Additional drugs, the new one that came in the market recently, maybe within the last 6 months or so, is called Tezspire. This is used again in a short form, but it is acting at a higher level than either the eosinophil or IgE areas. So in a cascade of reaction that occurs, which leads to the inflammation, and again the inflammation leading to attack of asthma, Tezspire acts at much higher level. So it is also effective, but again it is also given in shot form. The advantage of Tezspire is that it does not need to document presence of elevated IgE, which is required for using Xolair, or presence of elevated eosinophil count, which is required in use of Nucala or Fasenra, the two other shots, which are anti-eosinophil medications. So Tezspire can be used in anybody who has severe asthma or moderately severe asthma, which is not well controlled with conventional therapy. So this is given in shot forms. So it is not a pill, it's not an inhaler. It is new and seems to be very effective in reducing use of steroids or other medication. So Tezspire is a new one on the block and seems to be a good one or good alternative, provided somebody has asthma which is not well controlled and we have been unable to document by conventional means of presence of eosinophils or IgE being elevated. So that is a new one on the market. The latest one, which was approved by FDA recently as this week, is a combination of a steroid inhaler and an albuterol. Now, as we have been talking about it, the steroids are anti-inflammatory. So when steroids are used, it reduces inflammation. Using a steroid inhaler or using steroid in the nebulizer treatment is like applying cream to your skin. Here we are applying the steroids to the bronchial tubes where it acts locally, doesn't or not likely to be absorbed a lot to cause any systemic or total body effects. So now we have a combination of a short-acting bronchodilators like albuterol and then inhaled corticosteroids, which is approved by FDA this week for the use of asthma in adults. We still don't have it approved for children. So the concept that using steroids with bronchodilators is not new, but we were thinking of using steroids on a long-acting bronchodilators to control asthma. Here we are using steroids and a short-acting bronchodilators. The FDA has approved it. It will be available pretty soon. However, it will still need some additional studies and see how it functions or whether it is really an improvement in the treatment of asthma or it is just a old wine in a new bottle. Thank you for listening. Hope you like it and subscribe. Thank you. Have a nice day.